I would like to welcome everyone to today's CHE EDC Strategies Partnership webinar, which is titled Sicker, Fatter, Poorer, the Urgent Threat of Hormone-Disrupting Chemicals to Our Health and Future and What We Can Do About It, a conversation with author and leader in children's environmental health, Dr. Leo Trasande. Our moderator and interviewer today is Dr. Jerry Heindel, Director of the Program on Endocrine Disruption Strategies at Commonweal. We will leave time following the interview for a brief Q&A session. You may type in questions through the Q&A feature available on the menu bar at the top of your window at any point during the interview. After the interview, our moderator will read out questions for our speaker to respond to. We will get to as many comments and questions as we can during the Q&A period. Everyone on the webinar right now is muted with the exception of our moderator and our speaker. This webinar is scheduled to last for 30 minutes and is being recorded for our call-in webinar archive. With that, I'll turn things over to you, Jerry.
Well, good afternoon. I'm Jerry Heindel, and I'm going to be leading today's webinar. Today's speaker is Dr. Leo Trasande. After receiving his bachelor, medical, and public policy degrees from Harvard, Leo completed the Boston Combined Residency in Pediatrics and a legislative fellowship in the office of Senator Hillary Rodham Clinton. Prior to coming to New York University, he completed fellowship trainings in environmental pediatrics. He is currently the Jim Hendrick Associate Professor, Director of the Division of Environmental Pediatrics, and Vice Chair for Research in Pediatrics. He's also an Associate Professor of Environmental Medicine and Population Health at New York School of Medicine and holds secondary appointments at New York University Wagner School of Public Health and its College of Global Public Health. Leo is an internationally renowned leader in children's environmental health. His research focuses on the role of environmental exposures in childhood obesity and cardiovascular risks. He is perhaps best known for his groundbreaking publications that document disease costs due to endocrine disrupting chemicals in the US and Europe. Now Leo is again leading the field, this time by publishing a book titled Sicker, Fatter, Poorer, the Urgent Threat of Hormone-Disrupting Chemicals to Our Health and Future and What We Can Do About It. So Leo is here today to talk about this book. So welcome, Leo.
Thanks for having me.
So Leo, tell me what made you decide to write a book about endocrine disruptors and their effects on health and costs?
So first and foremost, a lot of the work that's described in this book really is a credit to you, Jerry, and your support in leading us to think about the disease burden and costs due to endocrine disrupting chemicals. And as you know, but not everyone else knows, we started this work through a series of meetings, first in Paris, but other places across Europe in 2014, when we were asked by the European Union to measure the disease burden and costs of endocrine disrupting chemicals there. And that was because Europe has, to a large extent, led the way on regulating this group of chemicals that can scramble our basic molecular signals in our body and thereby contribute to disease. And as a researcher, maybe I wasn't as surprised but as a dad and American, I was stunned by the costs in Europe alone, with 163 billion euro in costs due to endocrine disrupting chemicals, and that's based on less than 5% of EDCs, a subset of diseases due to those EDCs, a subset of costs due to diseases to those EDCs. So this is an underestimate of an underestimate of an underestimate, and yet it was 1.2% of Europe's gross domestic product. So as a dad, I came back from our work in Europe thinking about, well, wow, we have a situation where in Europe they've banned over 1,300 chemicals from personal care products, whereas the US has banned 11. when we have this legacy of the California requirement for flame retardants being added to furniture until up about 2013, whereas Europe had actually by then already banned certain brominated flame retardants in a variety of materials. And then we repeated the exercise in the US, and frankly, we're stunned by how much more the costs were in the US. And that's because policy predicts exposure, and exposure predicts disease, and disease costs us all as a society. So it was really the striking difference in the effects between the US and Europe that drove me to think about communicating this in a broader voice to the general public. I like to say that EDCs affect 99% of us, but probably 1% of us really know about the effects of EDCs. And that's to a large extent true as much in the US as it is in Europe, as well as elsewhere in the world. So I really wrote this book from the perspective as a dad, as a person, as a citizen, trying to communicate what we all can do at an individual level, and frankly, all can do together to reduce this growing threat, which I would argue is the second major environmental threat of our time. If you bundle climate change together with air pollution, you can make a compelling case that endocrine disrupting chemicals are the second greatest challenge of our time.
So tell me about the title of the book. Where did that come from, and where does the poorer part of that come in?
Right. So the sicker is a natural consequence of the breadth of diseases that we identified in our work. Everything from cognitive dysfunction to autism, attention deficit, hyperactivity disorder. The fatter is a nod to the growing research, in part by people like Bruce Blumberg at the University of California, Irvine, that have identified now over 50 obesogens, chemicals that contribute to obesity and cardiovascular risks. The prototype chemical potentially being bisphenol A, which makes fat cells bigger, disrupts adiponectin, which protects against heart disease, and is a synthetic estrogen. And then the poor really speaks to the economic costs to society. Now, we've already talked about the $340 billion in costs each year. That's not a cost that gets borne by industry, even though they produce the goods and services that ultimately contribute those consequences. We all functionally pay roughly $1,000 in taxes each year as a result of these exposures. We're functionally all poor as a result of exposures that make us sicker and fatter. So the poor really comes from the consequence that we all bear the weight of the consequences of these exposures as they are placed upon us as a burden on society.
So what's really the main message from your book? It sounds like this book really was written more for a lay type audience. So what's your message to them?
I come at this from the perspective of an optimist. You could think that reading the title, you'd be quite scared and think that it's a horror show. But what it's meant to do is, at one level, it's meant to communicate that we've come so far since Our Stolen Future and Silent Spring before that, in that we now know that there are human studies documenting direct consequences of these exposures that scramble our hormones and ultimately contribute to disease and disability. But it's a much more hopeful message than that. We've seen time and again that people have risen up and been the change that they seek through the power of their pocketbook and their wallets and their purses. Look at BPA free. Now, we can talk about the chemical whack-a-mole problem that was downstream of this, but BPA got out of baby bottles and sippy cups, not necessarily because of science. There was science available at the time that had documented concerns about infant exposure, but it was really media attention and consumer attention to this issue that drove the companies to change their manufacturing processes, and ultimately the companies ran to the FDA and insisted on a ban of BPA in baby bottles and sippy cups. Now, we have other problems that resulted from that. You now have BPS, some 40 bisphenols out there with BPA receding into the background, and BPS is at least as estrogenic and as toxic to embryos. But I consider that change a big victory for all of us, ultimately, and speaking to the opportunity that we can have as a result of a transparent conversation about what these exposures do. More recently, there were two major supermarket chains that got the buffet-style packaging with the perfluoroalkyl acids that were identified based on a study of 5 packages. And you saw on Instagram and Twitter pictures of these food packages being set aside, with the companies going to the industrial manufacturers and saying, look, we can't use these, we can't sell these anymore. We need you to change your manufacturing practices. And voila, there was a spontaneous shift in at least the way the upstream providers of these two supermarket chains did their business. And that's the kind of force multiplier that I think can really stimulate change and ultimately market share for safer alternatives with the growing green chemistry movement, as well as other opportunities. And just one other thought, we've seen double-digit gains annually in organic food sales, and that's really speaking to something of a movement. And you're seeing it now with margins narrowing as that market share is growing, and it's getting into big box manufacturers as well as other places you didn't see organic food a few years ago. So there is momentum here. There's a lot we have to do. There's a lot of gaps in our knowledge, gaps in societal understanding, and gaps in producer manufacturing and even resistance. But I see a lot of opportunity for enthusiasm and progress in the future.
So let's turn back to the scientific part. There were some diseases that you showed there was a lot of strong research supporting the role for endocrine disrupting chemicals. But there are other ones where the data was not very conclusive. So how are we going to fill those data gaps? What do you think is a plan to get that done?
So Jerry, when you and I and a bunch of people put together those scientific expert panels that really laid the foundation for this book, we implored them as much to describe the gaps. And in the papers that describe our work, not really in detail in this book, but in the scientific papers, if you dig deeper, to outline a roadmap for future research. Some in the laboratory, but a lot of it, as you know, is where we need more human-based research. And we've seen some enthusiastic progress and growth. You know, in the pediatric perspective, the Environmental Influences on Child Health Outcomes program is now actively looking at environmental exposures that disrupt hormones and thereby contribute to disease. That's not the only place where we have knowledge gaps. I, in the book, even suggest that there are particular knowledge gaps, shocking knowledge gaps in effects on the male reproductive tract. You know, we now have 40% of American men older the age of 40 reporting some degree of impotency. And the few studies we have are of occupational exposures and maybe a few chance studies of heavy metals. There's a lot of concern there, given that testosterone disruptors are well known. They include the phthalates, but other chemicals. And the reality is there are plausible links that need to be further studied. So in many ways, one of my missions in this book too is to educate the medical community to be more champions and leaders, both of the prevention aspects, but also of research.
So based on the book then, what's your solution to people being sicker, fatter, and poor? What's your plan to reduce exposures? What do you tell people?
So there are many safe and simple steps that are grounded in good science, mostly small scale studies, but the evidence is strong. So canned food consumption is a major source of bisphenol A exposure. Pete Myers, who I don't think is on today, and others, Fred Vomsal and colleagues, have found that thermal paper receipts are a substantial source also for bisphenol A. And we're already seeing a viral movement with BPA-free.me, a group of college kids in Amherst put together a great video for the millennials to really bring out the reality that they're being exposed to bisphenols either directly in their skin or through hand-mouth behavior from just taking those thermal paper receipts. And it's encouraging a lot of people to say, no, thank you, send me that electronic receipt. The irony is it's actually saving companies money by not making these thermal paper receipts and simply emailing the receipts along. Eating organic is a straightforward way to reduce pesticide exposure. It, in theory, is more expensive, but there are priority fruits and vegetables, the dirty dozen, and the leafy greens and vegetables in particular, where you eat that outer layer that you can reduce exposure. And we've already talked a lot about the progress such that it's not totally out of the realm of possibility for certain low-income and other populations where, by the way, studies have actually shown reductions in pesticide levels in urine. In addition, just recirculating the air in homes can get rid of substantial amounts of persistent organic pollutant exposure, such as the flame retardants I talked about. And now we have labeling through TB 117-2013, the California revised law that requires companies on new furniture to identify whether there's flame retardant or not in their furniture. So it's through those safe and simple steps. I've now developed a 30-second version, a 2-minute version of a pep talk that along these lines that I've given in a variety of audiences, and very few of them are even economically impactful. It's really just changing habits, if you will. Things like avoiding microwaving plastic, watching the recycling number, avoiding 3, 6, and 7 and such.
So in today's age, there are always people who don't believe science, that talk about fake science and fake news. How do you try to get through to these people what's really going on?
So it's always easier said than done, and it's tailored to the audience. It's somewhat, to me, appealing to what has worked. So for some who at least can get them to think about lead exposure some 30 and 40 years ago, how the undergraduates I teach at NYU are literally 4 to 7 IQ points smarter than I am because they had lead levels 15 micrograms per deciliter lower than I was growing up in the West Village back in the 70s. It wasn't the West Village of today, that's for sure. It was a much different environment back then. And speaking to the economic benefit that we've had, you know, we get a $200 billion economic stimulus of getting lead out of gasoline and out of paint to this day. So it's talking about what works and putting it in a way that shows the individual and direct benefits of these steps that at least starts the conversation. And in the end, as I say at the end of the book, you may not get people to agree with you at the end of the conversation, but often you may start with people who know nothing and who at least know something coming away from a disagreement, and will carry that away, and that may set the foundation for further thinking and further change of heart and mindset. Now, we all know that there's manufactured doubt out there. That's not going to go away. There are financially driven groups that will try to contort and distort the science, but that's for another discussion and another set of questions. I have worked more on changing individuals' minds and getting people to change their paradigm. I mean, a big part of this is obviously the reality that low dose exposures matter. We used to think that it was just the high dose exposures, the DESs of the world, the pharmaceuticals that were given to people, the rare mistakes, if you will. But now we know of over 1,000 endocrine disrupting chemicals in our environment. So it's just working with people based on what they've seen work and what they've seen in their lives. I mean, everyone I've talked to has some family member who's been affected by one of these diseases that are on the list that are due to endocrine disrupting chemicals, at least in part.
So I have a question that came from one of the viewers that's related to that and related to your comment about being an optimist. And it basically is, do you think that consumer power will end up being enough to change a system that really fails to regulate whole suites of similar chemicals?
I see it as left hand, right hand. Clearly, you need some regulation and some involvement. And you know, in the current political climate, at least in the United States, you might think that to be remote, but there's a lot of movement and potential that can be gained through these consumer movements that can set the stage. Remember that the revised Toxic Substances Control Act resulted when states stepped up their game and got involved in regulating chemicals used in a variety of products. And the reality is that that brought industry to the table and forced them to have a conversation in seriousness about what to do to reassure the public about safety. Now, we can get into a discussion about the lack of implementation and the difficulty in the years that have followed since President Obama signed that into law, but that again speaks to me to the opportunities for a groundswell to drive ultimately policy to prevent exposure. But in the meantime, you don't always need policy to drive the change we seek.
Okay, I'm trying to read the question. So this question is related to children now having higher levels of the PFAS as known endocrine disruptors and possible effects on thyroid. Do you think for you as a pediatrician, there's more monitoring like of thyroid hormone levels and things that should occur to help monitor to be sure those kids are okay?
Unfortunately, the thyroid hormone levels alone won't tell the whole story. So we now know, for instance, that within the clinically normal range, subtle shifts in thyroid hormone levels can be associated with decreases in IQ as well as other even clinically significant outcomes like ADHD and autism. We really will need eventually a broader biomonitoring platform, that is a platform that measures people's individual exposures, and that will take some more time because the technology is still expensive, it's not feasible, and it's not really hitting the clinical arena in the way it probably should in the future. But in the meantime, we can continue our awareness and communicate these safe and simple steps, which can reduce exposure without the need to doing pre or post testing to figure out whether you've actually reduced the exposure. You just have to take the steps.
Okay, great. So another question is to share your thoughts on how to mobilize professional communities such as public health, given that they are in a position to bring about a lot of change and change related to things like reducing the use of plastics in restaurants and food establishments and things like that.
So let me start with an embarrassing vignette about how little environmental health I got in my medical school curriculum. The average at the time was 1 to 3 hours in the entire 4 years. And I can tell you, I held retractors in open heart surgeries that went 6 or 7 hours at a time, multiple times as a third-year medical student. Not to mention countless hours of cutting stitches a bit too short or too long, depending upon the surgeon's mood. But that's me being a bit snide about surgeons who I respect highly as well. But more generally, we need to change the medical curriculum and public health curriculum to account for greater representation of environmental health. We teach in medical school arguably 10% of the contribution to actual health and focus our energies on the 10%, whereas the 80% that's environmentally driven gets maybe 2% of the resources and maybe 1% of the time. And that's also to say there's more to it that in that environment that is not getting the proper attention. It can also come from patients who also ask uncomfortable questions. The 3 least favorite words of a doctor I like to say are, "I don't know." If you ask a question about bisphenols and phthalates and get a blank stare, you often stimulate the kind of conversations that are awkward and uncomfortable, but will also drive people to do research and think about something in a new way. Medical doctors tend to be staid professionals, but they respond to that kind of feedback, and they like to consider themselves as lifelong learners. So this will have to come from the bottom up, from medical school curriculum, and also from the top down, from continuing medical education and other opportunities. Now, this is where the Endocrine Society in particular is a great leader. The American Academy of Pediatrics has started to put out a series of statements on environmental issues, ranging from climate change to food additives to pesticides and lead. So there are areas where you're seeing the goalposts move.
So Leo, there have been some papers showing that you can actually reduce exposures by doing a variety of things. But are there any data that really show that reducing those exposures will reduce disease incidence?
Not one that connects the dots all by itself in a single study. Now, insofar as we can find something that has a large impact on an exposure, and then a large and relatively intermediate or even relatively immediate outcome, there's a possibility that one could move the needle on this. One example down the line might be, rather than supplementing people and doing a randomized control trial of thyroid hormone in pregnant women, which has been done before to look at cognitive outcomes, maybe looking at an intervention to reduce thyroid disruptors and exposures in utero and their impact on thyroid hormone function, and then on even prenatal and perinatal outcomes. Those are the kinds of studies that may start to give us better readout. Some of the better studies are also these natural experiments where policy change produces a change in exposure. So let's say you ban chemical like organophosphates were banned in residential use in the middle of a Columbia study following a cohort of kids. And the organophosphate levels were much higher before the ban and much lower after the ban, and the associations were negative for head circumference, which is a great predictor of cardiovascular risk and brain development before the ban. But after the ban, those associations disappeared because the levels were so low. So that speaks to the other way you can potentially look at an intervention study to tease out these effects on people.
Okay, so the last question for today, if you want to really change policy, which lines of evidence are going to be the most effective? Is it the human epidemiology studies, in vivo studies, in vitro studies? What do you think about that?
My answer is all of the above, but if I had to prioritize based on what we saw in our work, Jerry, on EDCs, based on the outcomes with the strongest evidence, the human studies tend to lag the laboratory studies. Now, at the same time, I'll tell you that concordance of the evidence across the laboratory and human studies is really impactful. So I will never minimize the impact of a laboratory study, particularly animal studies. Yes, mice and rats and such are not humans, and there are differences in species that are important that may affect how the chemicals have their effect. But there's a lot you can intervene in that setting that can really change exposure and give you an insight into health outcomes. I would say that in an ideal world, the toxicology studies would be a bit more geared towards real human exposures rather than looking at tenfold differences in exposure, which is well beyond typically the range of most of the population in most of the human studies that we see. So it's making sure that the threads of evidence really fit together to provide that consistent and clear picture that I think is also important.
Okay, so there are a few more questions for you, Leo, and I think Maria will send those to you, and you can see who submitted them and respond kind of offline, because we're actually out of time now. So that was a terrific discussion. I thank you so much for your time and your insight, and taking the time out of your such a busy schedule to write a book like this, to try to get the word out, not only to scientists, to the lay community and policy and medical people. Thank you so much.
My pleasure. I've got one request for those who are interested in reading the book, who've already read the book. One is to spread the word, but also these days reviews are quite important in shaping how other people think about the book and potentially might go ahead and read it. So you can think about the various places where you might place reviews. I don't like to name companies, so I won't tell you who the major booksellers are these days, but they have consumer reviews of the book and such, and this is a great time for just that, so thank you.
Okay, thank you so much, Jerry and Leo. We are approaching the end of our webinar. A video recording will be available on the CHE website soon, and tomorrow you will receive an email containing a link to the recording. CHE's next webinar from our Effects of Plastics on Health series will take place next Thursday, February 28th, and is titled Bioplastics, Investigating Opportunities and Challenges. You can RSVP through CHE's website, healthandenvironment.org. CHE's next webinar from the CHE EDC Strategies Partnership will take place Wednesday, March 20, and is titled Exposure to DES During Pregnancy and Multi-Generational Neurodevelopmental Deficits. Details will be available on our website soon. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website. Additionally, if you appreciate these CHE partnership webinars, bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank Dr. Trasande for taking the time to talk with us today, and Jerry for being our interviewer and moderator. Thank you so much for joining us, and have a great day.